Hello, I'm VG Daniels in the Department of Medicine at the University of Alberta, here to talk to you about entrustable professional activities in postgraduate medical education. Are you a resident struggling to get your EPAs, or do you find your preceptors confused about their role? Well, it begins by understanding that there are two types of EPAs residents need to get. The first involves direct observation, such as when you're talking to a patient, or when you're doing a procedure, such as in the operating room or at the bedside. The second type is indirect observation, which are discussions often without the patient present, such as the typical case review. And many of these can be done remotely. Regardless of the type of EPA, the three key points are that the resident identifies the EPA before the encounter, then the teacher watches or discusses with the resident, thinking about if they're independent, and the teacher and resident discuss feedback, both what the resident did well and areas to work on and level of independence. And I want to emphasize the first point again. Don't spring an EPA on an unsuspecting preceptor. Just don't do it. You have to prime the preceptor so when they're observing you or discussing with you, they're assessing for independence. Here's a pro tip. As the resident, offer to fill in everything the preceptor told you in terms of strengths, areas for improvement, and level of independence on your mobile device, then just show them what you documented, and when they agree, just go ahead and hit submit. We're trying to avoid the save for later void. We got a lot of EPA stuck in the void. And by having your preceptor agree to just let you submit after they reviewed with you, we will save the EPAs from the void. If you have any questions or concerns, feel free to email me at vdaniels@ualberta.ca.